In this video, we're going to talk to you about how much exercise is too much and how much is too little to be doing after your hip operation.
So generally speaking, you can't really do anything for 6 weeks. You can't drive, you can't get back to cycling, probably not even swimming. Your scar needs to heal, and unless there's been problems, you're generally discharged from the consultant after 6 to 8 weeks. They don't want to see you. Okay, one of the first things to think about is the consultant's protocol. So really, in a way, it's his or her hip. So it depends on what kind of replacement you've had and which direction your big cut has come from. So be guided by that, and the hospital always tells you, and if they don't, they should, or the secretary of the consultant will know. I'd say that was the first thing. The second thing is we are all so individual. So to give you a set of exercises that are suitable for you, I have to know you. But as a guideline, I ask all my patients, what was your fitness level before? So if you walked the dog every day for 20 minutes as fast as you could, you're pretty fit, and so that's your guide. You can do a bit more than somebody who sat most of the time, and because they had other health issues or in a lot of pain, they didn't get up much. So okay, they're two extremes, but start with your fitness, your well-being, which will then lead you to your goals. Another rule of thumb I would say enough is, say, every hour that you're awake after your surgery in your home, you need to do half a dozen of at least 4 of the exercises that you've been given. There'll be some that you've got for the bed, and there'll be some to do while you're up and about. So obviously when you're in the bed, do the bed ones, and when you're up and about, do the up and about ones.
So generally, following your operation, you're going to come out of the hospital with a leaflet that's going to tell you what you can and can't do, give you ideas about how to get up from the chair, and give you exercises that are suitable for your condition based on the actual operation that you had. These here I've got fairly out of date. This is 1999 and 2013. Yours will be up to date.
Okay, I think the thing that sometimes we all need to realise is you've waited a year maybe in pain to have this hip surgery, and so getting well and, in my humble opinion, being the best you can be is your priority right now. And so just try and focus it not in a neurotic way, but in a kind of healthy, wholesome, carving out time for yourself kind of a way, which is different for all of us.
Going back to talking about exercise, after you've had your operation and you start doing these exercises, sometimes people start trying to do far too much far too soon. So how are you going to know if you're doing too much? Generally, when I'm working with people in my general Pilates classes, I can tell when people are doing too much because their form goes. So in other words, they start doing the exercise badly. So when you come to do your exercise, really look at yourself in the mirror or watch what you're doing and check that you are doing the exercises exactly as you were told to do. I tend to say less is more in Pilates, so exactly the same for you. You're better to do less correctly than doing more of them incorrectly, because you're not going to get the benefit from those exercises. Do you have anything to add to that, Tracy?
No, I think that's perfect. You could be more kind of scientific, if you like, and time yourself. So you start with 30 seconds and build up every day by, say, 10 seconds, and that gives you a goal. Always have one day off. Even athletes have a day off. And the other thing is, if you started with, say, 3 or 4 repetitions, as Kim suggested, then make sure you add another one daily at least. because the more you build up, you do two things. You actually change the structure of your muscles, so they become efficient because there are more muscle fibres, and two, you also increase the power battery of the cell of the muscle, so you create more energy, and those are two, that's a beneficial thing for your health anyway.
And just another thing I forgot to say in the earlier part, which is worth mentioning, is if you find you should be doing, say, 10 of an exercise and you only manage 3 properly, have a rest and come back and do some more later, little and often. So Tracy, I know some people really don't feel like exercising, they're in pain, they didn't maybe do much exercise before they had the operation. Why do they need to do these exercises? Why is it really important that they do the exercises?
That's a really good question, Kim. Why bother? Well, there's a really good reason. If you want to be walking again after the surgery, then you need to do them. You'd have become weak following the surgery, leading up to the surgery and after the surgery. And your hip replacement is only as good as the muscles, the strength of the muscles that are surrounding them. So you will have a much better outcome if you work those. And why put yourself through all of that pain and stress? Because it is painful and it is stressful on family members, on your partner, husband, wife, adjusting rooms and all that caper. So why put everyone through it if you're not going to maximise what you can do afterwards? It's that simple.
So the first activity that I'd like to talk about is your Pilates class. If you've been going to Pilates or you've been advised to do Pilates, should I go? And can I just go to the class down the road in the Scout Hut?
You need to answer that, Kim. Okay, so if you've been going to a general class, hopefully you and your Pilates instructor know each other reasonably well. So you need to have a more specific, tailored approach, and that depends on how much experience your Pilates instructor has got. So that's when maybe the physio and Pilates instructor can work together. I do know that there are some companies, namely ours, that weaves together the best approach for your hip replacement so you get the best results, and have a word, or take your exercises along that you've been asked to do by the physio. And like I say, a good Pilates instructor should be able to modify those sufficiently well.
One other question I'm going to ask is, how soon after your operation? Is it 6 weeks again before you can go back to that Pilates class minimum once you've been discharged?
Yep, 6 weeks is really what's recommended. It's going to take you 6 weeks to feel a bit more like yourself. And the doctor also generally will give you permission to drive. And unfortunately, it's this world where the doctors and the consultants have their authority even though they don't know how strong you are. You need to be able to have the strength and power and wherewithal to do an emergency stop.
Start again. One thing to be really aware of is that your Pilates instructor should ensure that you have permission from your specialist, your consultant or GP to exercise again. So Tracy, swimming is quite a gentle exercise to do. You're supported by the water. Is that something I can do? Can I do that before the 6 weeks are up? What should I do if I want to go back to swimming or start swimming?
First thing first, it goes back to what we said right at the beginning. It depends how active you've been before, and it also depends how good your health is. So, for example, you might have blood pressure issues, you might be diabetic, all of those things. So that's when your GP is kind of a main man or woman to give you guidelines. It's a fail-safe mechanism. It's about making sure your doctor knows, really. But the key is that your Pilates instructor and physio will know what to do if you get unwell, you know, and so talk with them about if they're happy for you to come. Swimming's great if you can stick to, you know, backstroke where your legs are going like that, or if, but I, you know, breaststroke, not keen, because most people have a kick screw leg, and that's just going to irritate your operated side. And 6 weeks before your scar really heals anyway.
So how about cycling? I'm guessing again nothing for 6 weeks, but if I want to get back to cycling, is there anything specific I can do to get myself strong enough to get back on my bike?
Well, great question. This is where having bespoke or tailored exercises for you. There are a couple of benchmark tests which we're going to film for you, and that will let you know if you're strong enough to do it without causing yourself more problems. Generally, a good physiotherapy department might have a static bike. If you can get hold of a second-hand static bike and just build up from there. Key is to not allow your hips to bend more than the 90 degrees.
So what about somebody who's been cycling for years, wants to get back on their bicycle? I'm guessing they're going to have to wait at least the 6 weeks, which is fairly standard with exercise. But what would you suggest they do to help them get back on that bike as soon as they can?
Okay, well, first things first, you want to, if you've got a static bike at home, that's a really good way of getting stronger. But obviously you have to really watch that you're not bringing the knee up more than 90 degrees, because the first 6 weeks is when your new hip is prone to dislocating. So you really do have to watch that. So you might have to put the saddle up a bit higher. I don't advise you go on the road before 6 weeks. I really don't. It doesn't matter how good you were before, unless of course you're an elite athlete and you've only had a hip resurfacing, which is not as big a surgery as a total hip replacement. So I hope that answers your question. You need to get those quads really, really strong. You need to be able to do a straight leg raise. You need to be able to balance on one leg, both sides, and you need to have some good hip balance. So if you're working with a good Pilates instructor or Pilates and physio, they will give you stuff to do that just edges you over. But the stronger and fitter you are, then the more you're going to enjoy your cycling, really. Just don't go too soon.
So Tracy, golf is often seen as a fairly sedentary activity for older people to do. If somebody wants to get back to doing golf, I'm guessing it's going to be a little bit more than the standard 6 weeks, mainly because of the rotation in the movement when you're doing golf. What sort of advice can you give to people that are interested in getting back to playing golf?
I guess one of the best things to do is invest in a golf, specifically for golf rehab. They're all out there, and that way you know that you'll be strong enough. To do it before the 6 weeks, you absolutely risk dislocating. And your consultant might have specific concerns. So, you know, right from the get-go, he needs to know that you're a keen golfer and that's what you want to get back to. Because the way the hip was done, it may be more or less prone to some challenges. Again, the body has an amazing capacity to be well and get better, but you do have to give it time, and it may be 6 months before you can actually return to golf, rather than 6 or 8 weeks or even 12 weeks. Again, if you're seeing a good Pilates instructor, we're going to have a whole series of videos about benchmarks for all the different muscle groups, so that should help you get to a strong place. And I think it's for your well-being as much as it is for your GP or your Pilates instructor or your physiotherapist. It's more about you being strong enough to be able to do at least the first 9 holes, I would say.
want to talk about just one more sort of activity that is associated with older people generally, and that's bowls. Yeah, he looks so sedate and so gentle. Can you talk about some of the pitfalls of doing bowls after hip surgery and what you can do to avoid long-term problems?
Okay, well, definitely for bowls, somebody has to get into a deep squat, and what I mean by that is if you're doing a bowls, either, doesn't matter which leg's been operated on, you have to get right down there and get right down to the ground and be able to come back up again. So that's quite hard work. So it's going to be at least 3 months, I would have thought, and then you have to practice being able to get up and down, and that's when you can use a chair, and we'll have a whole video on how to do that safely. I hope that helps.